everyone. Thank you for joining us today for our webcast entitled Calling All Medicare Part B Providers, an introduction to the QPP Resource Center for the Midwest. Today's presenter is Lindsay Ensley, Alterum's QPP Technology Lead. My name is Liz Jones, and I am today's moderator. Before we begin, I have a few housekeeping items to touch on. We will be keeping everyone muted during today's presentation. Because of the large number of attendees for today's webcast, we will not be having a formal question and answer session. If you have a question, we will provide you with an email address at the end of this presentation where you may send any questions you have. Also, you will be receiving a link to a recording of this webcast in a follow-up email from GoToWebinar tomorrow afternoon. The information you will hear in this broadcast is current as of today and is only intended to be a general summary. Since Medicare policies change frequently, the best way to stay up to date on current requirements is to review the actual written law or regulations. We encourage participants to review the specific statutes, regulations, and other interpretive materials for a full and accurate statement of their contents. With that, I will turn things over to Lindsay.
Good afternoon, and thank you for joining today's webcast. It's an exciting day for the QPP Resource Center team for the Midwest as we prepare to launch our QPP Resource Center portal and invite you to be a part of it. As Liz said, my name is Lindsay, and I have spent the majority of my career working in the field of healthcare technology, supporting the important work you do each day as you work with your patients. Today, I'm going to keep our agenda simple. Instead of starting with the what we are and how you can participate, I'm going to start with why the QPP Resource Center exists and why it matters to you. Then I will cover how you can participate and what the QPP Resource Center portal is. Sound good? Okay, let's get started. Let's begin with our first why, the healthcare legislation journey. Now, I could go all the way back to 1935 and talk about the various aspects of healthcare reform, but I'm going to start in the last 10 years with 1997, the SGR, or Sustainable Growth Rate Formula. In short, the SGR was a formula tied to gross domestic product, or GDP, where payments would be cut if physician spending grew more rapidly than the national GDP. It also began to pave the way away from unconstrained fee-for-service payments and towards new payment reforms focused on quality of service. Next, let's jump to 2006, where we have the Tax Relief and Healthcare Act, focused on cutting costs and really putting a new reporting structure into place called PQRS. Again, the focus on the quality of service. Following that, and really all throughout healthcare reform, is value-based modifiers, but really it began to be more prominently featured between 2006 and 2009. In the midst of all of that change, in 2009, we had the American Recovery Act. The American Recovery Act was put into place to help alleviate the financial pain of the recession that had hit the United States. As part of that was the HITECH Act, which kicked off efforts to implement the standardization throughout the healthcare space utilizing technology. This theme is continued into 2010 with the Affordable Care Act. The combination of the HITECH Act and the Affordable Care Act put the meaningful use in ICD-10 programs into place and reintroduced a focus on implementing accountable care organizations. Also in 2015, along with the implementation of ICD-10, is the Medicare Access and CHIP Reauthorization Act, or MACRA. The focus of the MACRA legislation continued the path towards value-based payments and away from fee-for-service. Within MACRA, there are three key focuses. There is the QPP, or Quality Payment Program, which is the actual core of the legislation, which provides the focus on patient care quality. The second two items, MIPS and APMs, are two key program components of the Quality Payment Program. MIPS is the Merit-Based Incentive Payment System designed for practices that need a more gradual approach away from the fee-for-service care model and towards a care quality model. APMs are the Advanced Alternative Payment Model. Under MACRA, if a physician participates in Advanced Alternative Payment Model, they will be exempt from the Merit-Based Incentive Payment System, and they may receive a payment from Medicare in the amount equal to 5% of last year's fee-for-service payment. To qualify as an alternative payment model under the MACRA statute, a practice in an APM must utilize certified EHR technology, report quality measures comparable to measures under MIPS, and bear financial risk in excess of a nominal amount, and/or are a patient-centered medical home. To date, there are 7 APM models and multiple organizations that you can apply to be a part of that support these 7 models. And here we are in 2017 implementing the Quality Payment Program. This is the first reporting year, which began on January 1st of 2017, and the industry as a whole is preparing for their first year of data submission to be sent to CMS in 2018. Let's continue the journey of why the QPP program with participation criteria. So, one of the first things you as a practice will have to decide is, are you a MIPS or APM practice? Let's talk about the different qualifications for MIPS or APM. Should you decide the MIPS path is the right one for your practice, it's important to know that your practice is only eligible for participation if you spend more than $30,000 in Medicare charges per year and have more than 100 Medicare patient encounters per year. It's really important numbers. It also only applies to a subset of eligible clinicians. This list that you are seeing, physician, physician assistant, nurse practitioner, clinical nurse specialist, certified registered nurse anesthetist, is only the 2017 list. We do expect that in 2018 and moving forward, this list will expand and eventually include all eligible clinicians. Also, it's important to understand that if you have an eligible clinician that is new to offering Medicare services, and it is their first year in 2017 in participating in Medicare, then they are not eligible for the MIPS track of the Quality Payment Program. It's something to be aware of. Also noteworthy is the fact that the MIPS path is flexible and that it does not require your practice yet to be utilizing certified health record technology, but supports you and your practice as you plan for your technology implementations and provides data submission options you can utilize until your technology implementations are complete. The second option, APM, advanced APM, has a different set of criteria. First on the list is you will need to locate and join an advanced APM if you would like to participate in the APM track. Second, you must be utilizing certified electronic health record technology. You must also plan to receive 25% of Medicare payments through your advanced APM, or plan to see 20% of your Medicare patients through an advanced APM. So these are all important considerations as you make a decision. Is your practice better suited for the slower paced MIPS program where you can pick your pace, or are you ready to go and fully functional as an advanced APM. Of course, there are many more details that go along with this, and I'm sure many of you have a lot of questions about if you're MIPS or APM and what's best for you. And as Liz said, at the end of this presentation, there will be contact information. Please feel free to contact us. We would love to either connect you to the right resource or be able to handle your questions ourselves, whatever is the right path for you. I will also be displaying a website address that will also provide you with more information here shortly. But let's move on to the next why the Quality Payment Program matters to you. And this has to do with the financial impact to your practice. So one of the things that CMS did was they created a Pick Your Pace. This was to provide you as practices with the flexibility of how you wanted to participate as the Quality Payment Program rolled out over the next few years. You have 5 different options. Option 1, you could choose not to submit any data in 2017. Of course, the downside of opting to submit no data for 2017 is that you will receive a negative 4% payment adjustment from Medicare. I'm sure none of you would like that. Second option is you could submit the minimum amount. If you choose to submit a minimum amount of 2017 data to Medicare, for example, 1 quality measure or 1 improvement activity for any point in 2017, you can avoid a downward payment adjustment. It doesn't mean that you will receive a positive payment adjustment, but it just means you avoid the 4% penalty. Next, option 3, if you submit 90 days of 2017 data to Medicare, you may earn a neutral or positive payment adjustment and perhaps even earn the max adjustment for that data submission. Of course, your adjustment is based not only on the amount of data, but also the quality of data that you submit. So even if you submit a full 90 days, it's not guaranteed that you would earn the max adjustment. The next option is a full year submission. If you choose to submit a full year of 2017 data to Medicare, you may earn a positive payment adjustment. Again, it does factor in the quality of the data that you do submit. However, you have an increased chance of a much better payment adjustment if you submit a full year. The last option is the advanced APM path. If you receive 25% of Medicare payments or see 20% of your Medicare patients through an advanced APM in 2017, then you may earn a 5% incentive payment in 2019. So those are some definite things to consider as you are deciding if you are going to be a MIPS or APM practice. Keep that in mind. We urge you to consider at a minimum option 2, because a negative % penalty is never a good thing. So go ahead and neutralize it and submit something. The next why is knowing your timeline. This is really important for the Quality Payment Program. So let's talk about the timeline. So you'll see here, I have a timeline that starts in 2017. As I stated before, the first performance period actually began on January 1st in 2017, and it closes at the end of 2017 on December 31st. All throughout the year, your job is to be recording quality data and recording how you use technology to support your practice. If you are participating in an advanced APM, it would be to continue your data submissions to your advanced APM for them to submit on your behalf. And on March 31st, 2018 is when the reporting period closes. So you have from January 1st, 2018 to March 31st, 2018 for a 2017 data submission. for MIPS. In order to earn the 5% incentive payment by significantly participating in an advanced APM, all you need to do is send your quality data through your advanced APM. However, if you are submitting through MIPS, then you will be responsible for submitting your own performance data for 2017. Of course, we have resources available to help you with that submission should you need it. In 2018, you will receive feedback from Medicare, so you'll have a pretty good idea how you're doing from a quality aspect and areas of possible improvement if you're on track for the next year for a negative or positive payment adjustment. And then you can make some adjustments in your practice. In 2019, you may earn a positive MIPS payment adjustment if you submit 2017 data by March 31st, 2018. So the very feedback you get in 2018 will result in some type of payment adjustment that will come into place on January 1st of 2019. If you participate in an advanced APM in 2017, then you may earn a 5% incentive payment in 2019. If your head is spinning right now, you will notice at the bottom of the screen, I have a URL, and this is for the qpp.cms.gov website. CMS has put together a fantastic website that explains the Quality Payment Program. It explains the different paths. It has resources available for you, and it has a lot of foundational information that you will find helpful. Please go ahead and visit that resource center. During this presentation, you could also visit our Quality Payment Program Resource Center, which I'll give you the URL here shortly. Also, and submit questions if you need assistance. Like I said, we're happy to help, but here's some additional information for you. Okay, so let's move from why the Quality Payment Program into how do you participate. We'll start with how to find help with the Quality Payment Program. So if you're feeling overwhelmed, don't worry, we're here to help you. And you're also not alone. Many people are feeling overwhelmed and unsure of their next steps. One of the benefits of the Quality Payment Program is that CMS has support available to you right now in this transition. What's important for you to know is that regardless of your practice size, help is available for you. It's just a matter of connecting you to the right resource for your practice. Across the United States, there have been 11 QPP or Quality Payment Program Technical Assistance Centers or Resource Centers created specifically to support practices like yours. These Quality Payment Program Resource Centers are funded by CMS and offer free technical assistance support for your organization. In order to receive help from one of these specific Quality Payment Program organizations, you must be a small practice of 15 or fewer clinicians, and these resource centers are primarily focused on supporting those small practices located in a rural area, a health professional shortage area, or a medically underserved area. If you're on today's webcast and your practice does not fall within these guidelines, remember, there's help still available for your practice as well. At the end of today's webinar, we will send all attendees information on how to find the right support network for their practice size and location. We are the QPP Resource Center of the Midwest. So you'll see here, if your practice meets the guidelines for support by a QPP Resource Center and you are located in the Midwest region of Michigan, Ohio, Kentucky, Indiana, Illinois, Wisconsin, and Minnesota, we are the QPP Resource Center for you. You'll see here on the bottom of our screen our website address, phone number, and email. If you are on today's webcast and you are not located in the Midwest but still would like assistance with being connected with the right resource, please don't hesitate to reach out. We would be happy to help connect you to the right resource for your region and practice size. Now I'd like to take a moment and introduce you to our QPP Resource Center of the Midwest. The QPP Resource Center for the Midwest is made up of 10 organizations with a long history of supporting clinicians in their region. Members include top-performing quality improvement organizations, region extension centers for health IT, practice transformation networks, universities, and rural associations. Let me quickly introduce each of our partners in our collaboration that are here to support you in your specific geographic location. For the state of Michigan, we have Altarum, MPRO, and Michigan's Rural Health Association. For the state of Wisconsin, we have Medistar. In Minnesota, Stratus Health. In the state of Illinois, we have the Quality Payment Program of Illinois, which is a partnership between Northwestern University and Northern Illinois University. Indiana is Purdue. Ohio Medical Advantage Group. And last but not least, Kentucky Regional Extension Center. All of our QPP Resource Center partners, we all are a part of the QPP Resource Center portal, and we all are offering a streamlined set of services for you, for your clarity and for your support as you navigate the Quality Payment Program. Within our collaboration, you will notice that we use a 3-tiered system. This is to help you in a structured workflow establish your starting point. Once it's been established and clarified, help you with planning and moving forward. And then we actually can help you implement and measure your progress. Now, one of the things we've learned in the years of experience across our collaborative is that each practice we work with has a different starting point. Some of you are at the very beginning of your QPP journey and have a lot of questions about how to move forward. Others of you have the technology processes in place and are already pulling together your quality data submission for 2017. But you may have some questions about how to submit your practice information. When you join the QPP Resource Center for the Midwest, we walk you through this 3-stage remote technical assistance process to ensure, number one, that you're eligible for the QPP program. We help you establish your unique baseline or starting point. We help you create your plan to move forward. We provide you with supporting resources and then help you measure your progress towards QPP success. Let's take a closer look at each stage in the process. In the starting point, we actually capture some information about you. So not only do we have you create your user account for the QPP portal, but we ask you to tell us about you in your practice. How many eligible clinicians you have? Are you planning on submitting or reporting 2017 data? Do you plan to submit test data only, or do you plan to do a full submission or perhaps a partial or 90-day submission? We'll ask you these questions about what your intentions are, and from there, we'll move you into the empowered planning stage. Now, all along within each stage is interaction with a QPP advisor. QPP advisors are there to help you with reviewing your information, asking you the right questions at the right time, and then helping you move forward with the education, the readiness assessment, the project plan, resources, and MIPSCAST. The education in the empowered planning is a foundational set of trainings that we offer. They are brief trainings. They are online. 2 of them are videos. 1 is a document, and they may change as the program progresses. But what they do is they provide you with the foundation that you need to know for the QPP program. So we have a great QPP 101 training, and then we also have a document called the Readiness Assessment Preparation Document that actually helps you understand the implications of how you answer questions in your readiness assessment. Your readiness assessment is what establishes your baseline. It tells us where you're starting, it tells us what questions you have, and what potential things you do or do not know about your current state in your practice regarding technology. From there, we utilize your readiness assessment information and we create your project plan. It's a tailored project plan based on the responses to your readiness assessment. And within your project plan, we actually have curated resources attached to each item in the project plan, if applicable, to support you as you plan and implement your project plan. All of this is real time for you as you're working through the process. You'll always be able to log in and access this information. So if you come back to it or you have a planning day once a week, it will be available for you. MIPSCAST is a great tool that we are integrating into the QPP portal. It will be here late summer. And what MIPSCAST does is that it actually utilizes your quality data from your practice to help you predict your estimated final score. So at the end of the year, you will receive from Medicare an estimated final score, which will indicate if you will receive a positive or negative payment adjustment. This payment adjustment obviously is something you want to be aware of. So we are giving you a tool integrated in with the QPP Resource Center portal that will allow you to be able to track your progress in terms of quality. This is very exciting because we are looking to empower you, the user, both from an education standpoint, but also with technology tools that will help you prepare for the next year. In the last phase, we have implement and measure. And again, you'll continue your project planning in this phase. You're working your plan that you started in the empowered planning phase. You may update that plan. You'll measure your progress working with the QPP advisor. You'll continue to access and utilize resources as appropriate for your team. And then you'll continue to estimate and look at your score, estimate your final score for the end of the next year. Now in 2017, the data submission is fairly straightforward, but it's a good thing to begin practicing now because in 2018 and 2019, it will get more complicated. The nice thing is that MIPSCAST does all the work for you. You do some simple data entry or uploading of data files, your quality of data files, and we begin the calculations there, and they're right on the screen. We also will be offering an attestation toolkit. This is how you will actually submit your data in the beginning of 2018 for 2017. So offering you support as you begin to submit your data to Medicare. Okay, so that's the end of the how. How can you access this? The QPP Resource Center is available immediately for you now. You can actually click on the Join button, and I'm going to show you how to do that right now. So what is the QPP Resource Center? Your QPP Resource Center for the Midwest is a web portal. So we have created a web portal. It's live now at www.qppresourcecenter.com. To date, you will only see a Join button in the upper right, but we will be adding a Login button available on Monday, June 5th. So those of you that are on the phone that have previously clicked the Join button and created an account will now be able to log in and begin to receive your technical assistance through the QPP portal. For those of you new to the site, you can go ahead and click the Join Now button now on the QPPResourceCenter.com website and actually join our QPP portal. Very simple for you. You can always access it, whether you're at home, whether you're at work, it's available for you there. If you were to click Join Now, you would get a simple Create New Account page. The page has about 3 different sections. The first section is collecting your account information. The second is information, specifically your practice address information, and the third is just a few more questions around your practice information. So the number of clinicians you have, if you participate in a TCPI network, and a few other questions. Just some very easy questions for you to answer that allow you to create an account. once you've created an account, you can log into the QPP portal. So for those of you that have already joined the portal, on Monday, June 5th, you can click the login button and you will see a space to put in your email and your password. If for some reason you don't remember your password, go ahead and click on that Request New Password link. When you do that, you'll get an email sent to your inbox with a link that will allow you to create a new password. Very easy process, but should you need help, go ahead and use the contact information at the bottom of our homepage on the QPP Resource Center website, and you'll see our phone number and email address, and send us an email or give us a call and we can walk you through the process. Once you've logged into the QPP Resource Center, you'll notice that you have a My Resource Center dashboard. The My Resource Center dashboard is essentially your homepage. You'll notice that across the top we have My QPP Advisor Team. This is the information on how to contact your QPP Advisor Team for your state. So just as we have regional partners in 7 states, if you belong to a state, let's say in Indiana, when you were to log into the QPP Resource Center, you would see your team's information from Indiana. So again, we wanted to ensure that on a state-by-state location, you had access to someone in your state familiar with your state regulations. This applies to all of our partners. So whatever state you're in, whether it's Wisconsin, Ohio, Indiana, Illinois, Kentucky, I'm sure I missed someone. When you log in, you'll be able to see that state's contact information. Second piece here is you'll notice that the My Team section is blue, and this is actually your starting point. So one of the things that we've implemented is a structured workflow within the QPP Resource Center portal. This is to help make things much easier on you as a practice. So we're giving you the right next step at the right time. Every step you move forward, you receive an email in your inbox letting you know that you've completed a step, and either it will tell you what your next step is or that a QPP advisor will be in touch with you. Either way, you're always receiving communication on your next step. This particular next step is to actually begin by completing your practice's information in the My Team section. Again, this is important information because it tells us your eligibility for the Quality Payment Program. Once you've completed that and submitted it, a QPP advisor will actually review that information and either just completely approve it and move you forward, or they may email you or give you a call and ask you a few questions. Once all the questions have been cleared up, they'll move you forward. Here's a look at the My Team form. You can see account information, practice information. If you were to scroll down, you would see clinician information. But once that was approved, you would notice some changes on your My Resource Center dashboard. You would notice that an education link has turned blue, and also once you complete your education, that there's a readiness assessment. You may notice that there's some links here that are in gray. These are inactive links. This is on purpose. Again, it's a progressive workflow, ensuring that you have the right step at the right time, so we can actually ensure that your project plan is the best project plan for your practice. So we'll go ahead and take a quick look at your readiness assessment. So when your readiness assessment is available, this is a good look at what it looks like. It's a pretty easy web form to move through. You can use a mouse, you can use a keyboard, and there's about 27 questions in the readiness assessment depending on how you answer. The questions, there may be a little less, there may be a little bit more. But once you have completed your readiness assessment, it will go to a QPP advisor for review. Remember, your readiness assessment is essentially your baseline assessment. It's establishing where you're at now and then how we can help you move forward. It actually is tied to your project plan. There's logic in the system that ties the responses for your readiness assessment and generates specific project plan items based on your responses. So again, our focus is creating a tailored experience for you all along the way. You'll notice here that once I've submitted my readiness assessment, this is just an example email that I've received, letting me know that a QPP advisor has approved my readiness assessment and my project plan is now available. So if I were to log into my resource center on this particular day, I would notice that my project plan has also turned blue. You will notice that it's now an active link as well as the resources. This is great news. So now I can actually begin to implement the plan created for my practice from my baseline assessment. Here's an idea of what our project plan looks like. Our project plan is split into 3 sections: IA, ACI, and quality. When the cost component comes into play in 2018, there will be a 4th section of cost. But for now, we're just focusing on the required sections by Medicare. So there's a header for each section, which you'll see here highlighted. And then within each section, you have an action item for your practice. Now, what's important to notice is that associated with each action are some links. These are curated resources specific to that link to help you as you approach that particular task. So one of the benefits of the QPP Resource Center portal is that we want to give you access to the right information at the right time to make you as efficient as possible. So we looked at the task and said, okay, let's give them the most applicable resources for this task to help them accomplish their goal. So you'll see this in every project plan on the QPP Resource Center website portal all throughout. They are active links, so it could be a video, it could be a link to another website, perhaps the QPP CMS website, to a particular page or resource on their website. It could be something we've created like a PDF or a Word document or another video that we found somewhere that we think would be helpful for you. So real-time access to real resources for things you're actually working on today. Now, let's talk about MIPSCAS. You'll notice that it's not active yet on my dashboard, and this is because it's coming late summer. We're really excited about MIPSCAS. Again, our focus is how to empower you, the practice, as you're working towards QPP success. So let's take a look at MIPSCAS. As I said before, it is a final score predictor or estimator tool that utilizes your quality data all throughout the tool to provide you with an estimated score for the end of the year. So this is MIPSCAS. What is important to know is that if, in fact, you have the ability to upload your quality data, meaning you have access to a QRDA3 file and or other quality files, we do have the ability to import specifically your QRDA3. We are looking at additional file types as well. If you do not have the capability to import that file, it's okay. There is the ability to manually enter it. What you're looking at here is the output of that quality file. So you'll notice that down here you'll see some different percentages. I can see here for registry that I scored 35 out of 60 points for a 58.33%. For EHR, I scored 46.3 out of 60 points for a higher percentage of 77.17. Now, why am I seeing multiple percentages? It's because for different measures, I will actually, based on my quality data, have a higher chance of scoring better on some measures than other measures. So what we do is we give you the opportunity to see that data and allow you to make the decision of what you will actually report to CMS. So we're just taking in your information, we're doing the calculations for you, and then we're showing you the output of those calculations. If it were me, I would want to pick the highest percentage reported to go to CMS so I have the best possible score. Now you'll also notice up here we have something called decile points, bonus points, total points. and an overall category score. These are all very helpful. Some of you may be wondering, what is a decile point? How do I know if I have bonus points? And how do I know what my total points are? So that's part of our job in MIPSCAS, is to do all of those calculations for you. Now you will see some of this data down here within each section, so you can actually begin to track and count some of this yourself. So based on your selection here, the numbers up here may actually change, which is important to know. Let's look at the next page, advancing care information. So just like the quality page, we have some minimal data entry. We'll ask you specifically which items you are looking to report for 2017. And then depending on your selections, we may have some bonus points come into play or some performance points. You'll also notice down here that we have some measures. These measure numerator and denominator should come from your meaningful use dashboards. If whether you have one from an EHR or another program, however you generate those, it's a quick manual entry for the required ones and then any additional ones you wish to report. Same up here, you'll see a base score, performance points, bonus points, total points, and your category score. So again, just providing you with the most information possible. We're doing the math for you so you don't have to figure it out, and allowing you to look at your data from a different point of view. Let's look at our final predicted score. So let's say you move through each tab, quality, advancing care, improvement activities, and at the end we actually give you a composite score. So this is your estimated score or your predicted score for the end of the year based on today's data. Now over time your data may change and it may actually improve. It also could go the other direction of not improving, but the whole point of MIPSCAS is to actually allow you to gauge that progress. So you could come in here you could come in here on a monthly basis, a quarterly basis, a yearly basis, and actually take a look at your quality data to give you an idea of how to plan for the next year. So on the left-hand side, we give you summary information of your predicted score, how you actually scored. Then we give you a graphical representation of that score. Again, our whole goal here is to help empower you with understanding what your estimated final score is and if you're headed for a negative or positive payment adjustment in the following year. It's a great planning tool. So we're excited about it. I'll be looking for it late summer. And if you have any questions about MIPSCAS, if you'll be using it, how to use it, please just be sure to send us an email and we'll answer that question for you. So, what is next? Let's talk about 3 simple actions you can take today. Join, check out, and log in. You can join the QPP Resource Center for the Midwest today. All you need to do is go to our QPP Resource Center website, click the Join button, put in your information, click Submit, and you've created an account. Number 2, check out the Quality Payment Program website at qpp.cms.gov. Again, this is a great resource for you, especially if you have a lot of questions and you're in the beginning stages of what do I need to do, how do I get help, beyond other webinars or people you may talk to. Be sure to check that out. Also, please reach out to us with your questions. We're happy to help connect you to the right resource. And then for those of you that have joined the QPP Resource Center, be sure to log in on Monday, June 5th. You'll see that green login button, and we're excited to get you in and receiving technical assistance through our portal. And last, here's our contact information and how you can reach us. You can give us a call or feel free to email us.
That concludes our presentation, and as a reminder, if anyone has any questions, please email them to qppinfo@altarum.org. Thank you everyone for attending and have a great day.